Good afternoon. First of all, let me thank Dr. Veena for giving me this opportunity. Headache is a problem for both parents as well as for the children and as well as for the treating physician. Nearly 20 to 30% of our practice is consists of children, pediatric age group, and most of them, apart from routine allergy, injury and all, most of them present to us with headache. So tackling and understanding this headache in children is very important to us. So that's the reason probably Dr. Veena chose me to give this small talk. So primary, it can be classified primarily into primary and secondary headaches. So regarding headache, there are certain pain-sensitive structures like large venous sinuses, dural sheath, cerebral arteries with the lining, ophthalmic division of the fifth nerve. So traction, distension, or stretching, all these can result in headache. So ocular causes also form a very important component which can cause headache. So particularly visual disturbances, unrecognized refractive errors, particularly low degrees of astigmatism, convergence insufficiencies, muscle imbalances, squint phorias particularly, ocular inflammation, and childhood glaucomas in the order of importance and occurrence. So most of these are the ocular causes of headache, which we should be able to find out. So refractive errors are the most common cause of defective vision and headache. Hence, all children with headache have to undergo a dilated vision examination and also a dilated refraction. So, as we know that astigmatism in lower degrees, apart from visual disturbance, will also cause headache. And so cycloplegic refraction is a must. Convergence insufficiency is mostly unrecognized, but it is very important that we test the children with headache for all this. So they can be a cause of recurrent headache, particularly in this age when they are trying to have a lot of close vision. Near vision is becoming more. So this also should be considered when the child is having headache, presents with recurrent headache, but it is symmetropic. We find there is nothing abnormal in refractive error. So the one important thing is, as the child starts doing the close work, the symptoms become exaggerated. So we find that as the day advances, the child develops headache. So the child goes to school normal, but when it comes, there is a call from the school that child is having headache, please take. That is because the child has been doing close work from morning till afternoon. So that is one important thing which should alert you to the possibility of this convergence insufficiency in a patient, in a child with normal refractive error. So these are all measured. We know all that routine testing of convergence insufficiency is an important thing which should not be forgotten. So near point of convergence, at least for 30 seconds at 10 centimeter fixation is very important. So that timing and the distance is very important to pick up convergence insufficiency. Accommodation spasm usually occurs in children with refractive errors, close reading distance, and prolonged close work with dim illumination. So sometimes the child can present with diplopia for in a near. Muscle spasm can be a cause which can trigger headache. So the esotropia during close work or near may be the cause. That may be the diagnostic clue for accommodation spasm. So relieving the occlusion by occlusion or by cycloplegia will be a clue for understanding or diagnosing this accumulation spasm. Apart from being a therapeutic mode, this will also be a diagnostic. So digital eye strain, it's becoming very common. So unregulated and excessive use with very little reading distance, because the child can see at a very short distance also. So they use it. Many times the parents tell that the child completely covers itself, and underneath the blanket it is using the cell phone. So prolonged use again in a short distance with dim light can trigger digital eye strain and result in headache. So migraine in children is another unrecognized and sometimes missed cause of headache in children. This migraine in children is not like that of an adult. Even though classical migraine starts in early age, the manifestations and clinical presentations can definitely be varied. The children behave in a different way than that of an adult. While adult will present with a unilateral severe pain associated with vomiting, aura, fortification, spectra, and all those things are not present in a child with migraine. So the duration of this migraine itself is very less. Maybe 2 to 3 hours is at a maximum. But in that of an adult, it ranges from a day to 2 days also. So that prolonged duration of migraine attack is not there. So it is a very short duration, so which can be attributed to other causes. So migraine can be missed. So migraine becomes a recurrent, is an important cause of recurrent headache. So detailed history and symptoms of this headache will help us to understand or diagnose migraine in children. So secondary headaches are not due to ocular cause per se, but they may present with a headache like dental malocclusion, with can result dental infections, can result in headache. Epilepsy, intracranial tumors, meningitis, all these can also give, these are all secondary causes of secondary headaches, which have to be kept in mind when all the other things are all absent in a child with headache. So an approach usually begins with a history, detailed history, how it started, how long is the duration, what are the provoking factors, what are the relieving factors. Apart from that, you have to give importance to the diet, water intake, domestic and school stress. It's becoming very common because everybody wants their child to score the first mark. So this has become, and they want the child also to excel in other extracurricular activities. So the child is pushed through various tuitions, one after the other, throughout the day, with hardly any time for play, which is a stress itself. So the sleep pattern, whether the sleep is disturbed, usage of these electronic equipments, all these have to be taken history in a detailed history. So examination, ocular examination, there are a lot of things to do, but basically for a common generalist, visual acuity, near point, cover test to find out phorias, a dilated fundus examination, to all these very basic examination techniques. So a headache in children are an entity by themselves. It cannot be equated to that in adult. So careful approach by history examination will lead us to the cause of headache and efficient management. Thank you so much.